My name is Omona Kizito. Yes. I'm a medical doctor by profession. Yes. I'm a health service specialist. My study is knowledge, attitude, and medical incident reporting among healthcare professionals. A study of Midigo Health Center 4. According to Mobis Medical Dictionary, medical incident reporting is written and verbal reporting of any event in the process of patient care that is not consistent with desired patient outcomes or routine operations of the healthcare facility. Normally in healthcare, the desired patient outcome is that whichever patient that has come to hospital must go back home when he or she is fully improved or is even fully cured. And any event that has made such a desired outcome not to be achieved needs to be reported, and that is what they call medical incident reporting. Medical incident reporting is a key tool for improving patient safety in healthcare, and for that matter, improve quality of care. And according to researchers, the better the knowledge, the attitude, and the practice of such a concept, the better definitely the quality of care. The study was in Midigo Health Center 4, which is a government health center 4 in Yumbe district in Uganda. And the health center 4 had a bed capacity of 73 beds, according to Ministry of Health, Uganda 2015. And the sub-county has a total population of 37,100 people, which is 7.6% of the total population of the district. That is according to Uganda Bureau of Statistics 2015. This health facility is supported by a church-based development partner called Calvary Chapel of Midigo that contributes about 35% of healthcare professionals to the health facility. Problem statement. The perceived the perceived knowledge, attitude, and practice are still low in many Ugandan health facilities, especially with regards to medical incident reporting. And the main problem are presumed to be knowledge gap, negative attitude towards reporting, and low level of practice of actual reporting of medical incidents among healthcare professionals. And presumably, the causes are due to lack of professional medical development or continuous medical education on the subject matter, fear of punitive consequences of reporting, lack of motivation to do so, that is to say, poor reporting culture within our healthcare system, and perceived lack of time due to understaffing, among others. The effect of this problem are definitely two. One is increased healthcare risk for patients. Definitely in giving healthcare, there's some minimal level of risk that are associated with it, but in the event that certain measures or certain interventions are not put right, the level of risk will definitely get increased. So one of the effects would lead to increased healthcare risks. Another one definitely is compromised quality of healthcare services. So as a researcher, I thought this deserves special attention, and for that matter, I set out to find out the magnitude of the problem in Midigo Health Center 4. The objectives of the study, the broad objective is to contribute to improve patient safety in healthcare through creating awareness on the need for medical incident reporting among healthcare professionals in Midigo Health Center 4. I had 4 specific objectives. One was to assess the level of knowledge about medical incident reporting among healthcare professionals in Midigo Health Center 4 by April 2016. 2 was to determine the attitude of healthcare professionals in Midigo Health Center 4 towards medical incident reporting by April 2016. And 3 was to ascertain the practice and the extent to which medical incident reporting is practiced in Midigo Health Center 4 by April 2016. And the 4th objective was to establish the factors affecting medical incident reporting in the health facility by April 2016. My study was a descriptive cross-sectional study, predominantly quantitative with minimal aspect of qualitative component. Sample size was 44 health workers. Sampling techniques used: purposive sampling for medical officers, clinical officers, midwives, laboratory and theater staff For the rest of the cadres, other than those, I use simple random sampling. Data entry analysis and presentation. I use basically two computer software, that is SPSS, Statistical Package for Social Sciences, and Microsoft Excel. Study findings, socio-demographic characteristic, the response rate was 100%, 26, that is 59.1% were male, meanwhile 40.9% of the respondents were female. The majority of the respondents, that is 52.3%, were more than 35 years of age. Meanwhile, 45.5% were in the middle age group, then 2.3% were in the younger age group of less than 25 years. Medical officers were 4.5%, clinical officers 6.8%, nurses 43.2%, midwives 11.4%, theater staff 9.1%, laboratory staffs 6.8%, and others 18.2%. In terms of level of knowledge about medical incident reporting, I was able to find that the level of knowledge was at 84.1%. That is those who knew about medical incident reporting within the health facility. However, out of all those, when you categorize, when you go further to assess the extent of the knowledge, in terms of excellent knowledge, average knowledge, and fair knowledge, you will agree with me that the part in blue, which is 10.8%, are those who had excellent knowledge. And this is really small compared to the overall rating. And out of this 10.8%, 75% of them are nurses and 25% are clinical officers. Meaning those who had excellent knowledge were either a clinical officer or a nurse. However, this was not statistically significant. My p-value was 0.39, which is quite high. In terms of the attitude of healthcare professional toward medical incident reporting, a question was asked about strong negative statement and a strong positive statement about medical incident reporting. And the results showed that 97.7% of the respondents had very strong positive attitude towards medical incident reporting, as opposed to 2.3% who did not have positive one, who had negative feelings about incident reporting. The practice, 72.7% of the respondents within a 5 years period had ever participated in medical incident reporting, while 27.3% never. However, when I tried to analyze the facilitating factors and the barriers, among those who participated, the 72.7%, they had two major reasons why they participated. One is they had strong positive feeling to improve patient safety, and this is, as we have seen in the attitude, which is at 97%. Then, on top of that, they were also knowledgeable about the subject matter, that is about medical incident reporting. However, in terms of the barriers, those who never participated, the 27.3% that did not participate within a 5-year period, they did not do so because they had limited knowledge in terms of they failed to know where and how to do the reporting. And this was coupled with the poor culture of reporting within the setup where they were for the last 5 years. However, uniquely speaking, fear of punitive consequence of reporting was not a factor, was not a barrier that made them not to participate, as many of the researchers have been able to put. These are the sources or the references I use. In conclusion, medical incident reporting still remains a key tool in improving patient safety. The greater the practice of reporting, the better, as evident by the strong positive feeling towards medical incident reporting. Educating health workers on reporting and strong positive individual feeling to improve safety have remained the major factors facilitating medical incident reporting, as I reported in under my facilitating factors. Then likewise, lack of knowledge on where and how to report, coupled with weak institutional culture of reporting, have remained the major barriers to practicing medical incident reporting, especially in Midigo Health Center 4 in Uganda. Finally, future steps. Let many more researches be done on medical incident reporting in healthcare facilities to assess their status, bearing in mind that this is just one health facility within the district. And we needed to do similar research in many other remaining health facilities, which I've already discussed with the district health institutions, and we are in the process of doing another research probably next year. Two, let continuous professional development, that is CME, be done in Midigo Health Center 4 and other healthcare facilities in and around Yumbe district. Because of this research, it has already been done, in fact, because I disseminated the finding and the district health officers gave me a go-ahead, and we disseminated this finding. And we use it as a point to do this kind of professional development or medical education. And it is now supposed to be rolled out to the different other health facilities. Then lastly, more funding still needs to be more funding are still needed for healthcare researchers. This research, I use my personal resource to do them. I was not supported, but of course, for us to get a lot more in healthcare researchers, we need some kind of external funding that can be able to motivate many other health workers. This is